Now, your health, your safety. This is ABC7 News.
Hi there, I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 to get answers for you in real time. Now today we have two experts who are fighting to infect themselves with COVID-19. That is right. They want to contract coronavirus and they want to do it to help you. So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. I'm sure you have many. So joining me now are Josh Morrison, a Brooklyn attorney and executive director at Waitlist Zero. That is an advocacy group for living organ donors. How are you doing, Josh?
I'm doing very well. Thanks for having me.
Excellent. And Carson Poltorak, a Stanford graduate and soon-to-be med school student at the University of Pennsylvania. How are you doing, Carson?
I'm doing great. Thank you. I'm excited to be on here.
Absolutely. You're still living in East Palo Alto right now near the university where you're doing research. I should mention both of you, Carson and Josh, want to be exposed to COVID-19 as part of a movement called One Day Sooner. Now, Josh, you founded One Day Sooner. Explain the meaning in that name and what that has to do with infecting healthy people with coronavirus.
Well, basically what One Day Sooner is about we want to try to get a vaccine, and if it's going to be something we can do to get a vaccine even 1 day sooner, we think that has enormous benefits and it would justify things like human challenge trials. And that's what you were talking about our being willing to expose ourselves to infection, is to do this special type of trial to test a vaccine called a human challenge trial, which can actually speed up the testing process because you're able to figure out whether a vaccine works in a kind of controlled environment very quickly on a relatively small number of volunteers, compared to a much larger study that would take place over maybe 6 months in something closer to the general population.
All right, so you say controlled. How do you envision that happening?
So usually the way a study of a vaccine to figure out its efficacy or effectiveness in reducing infection, usually the way that works is people in the study get either the vaccine or a placebo that doesn't work in the beginning of the study. Maybe in about a month, the vaccine will be effective, and then you just passively observe them over the next, let's say, 5 months for something like this where you're trying to move quickly and see who gets infected and who doesn't, and you hope that the group that got the vaccine gets infected less often or gets less serious disease than people without. What a challenge trial is you still get the vaccine, same way you would do it normally, except after that first month, once the vaccine might have gone into effect, people go to a sort of medical facility, like an isolation facility, where they would be under constant observation, and they actually expose themselves to the virus through an artificial means by doctors. So there'd be like a nasal spray that would be determined in a study, and people take that spray, and hopefully what happens then is that people who have gotten the vaccine, that those people are less likely to be infected. And because something like 70 to 80% of the people in the challenge study would be infected, you're able to get a significant numbers and figure these things out a lot more quickly within weeks of doing that exposure than you would with the traditional study model.
Okay, so I posted on Facebook that you guys are thinking of doing this, and a lot of people are incredulous, but it doesn't seem so incredulous when you look at how many people have signed up. It's a lot, right, to be volunteers?
Yeah, absolutely. It's been more than 13,000 people from more than 100 countries have signed up in just the last month.
Whew, okay, well, among them, Carson, you are 23 years old. You just graduated from Stanford. You're going to med school with your whole life ahead of you. Tell me why you think you should be the one to sign up.
Well, I think it's a good question, right? I think we have to weigh sort of what do we think the benefit of doing this is, versus any potential risks, right? And so, you mentioned I am going to go to medical school. My goal in doing that is to, help save, lives or improve, human healthcare and welfare. I would have to be pretty overconfident in my abilities as a doctor to think that I would be able to help the scale of people that I would be able to help by participating in this trial at some point in my career, right? I think that, if you just do the quick back of the envelope calculation on, a trial like this, shaving potentially a month off of vaccine deployment, that's potentially tens or hundreds of thousands of people. And to me, that scale is just, it's huge. And it's such an incredible opportunity for impact and to make the world a better place.
All right. And given that you are, in that age group where your risk is a little lower because you are young. But still, I mean, what if you are in that tiny percentage of the young and healthy who suffers tremendously or even dies from it? Do you not think about that?
No, I mean, I certainly think about it, and I don't think we should shy away from it. I don't want anybody participating in a study like this without the full appreciation that there is a risk of, lethal, there is a risk of a lethal event. You could sign up for this and you could die. But I sort of right myself, emotionally by just reminding myself that I do believe that this is ethically the right thing to do. I think that, I don't believe that I am necessarily like more valuable or more deserving of life than anyone else. And if my one life can, help give thousands of other people their life back, then, again, I think that it's scary on the individual level, but I think it's worthwhile on the broader ethical level. What
do your friends and family say to you?
Yeah, so I've had some different responses from friends and family. I think my friends are broadly incredulous, although I will note that one of my absolute closest friends, who's also doing an MD PhD like I am next year, was convinced, and he has signed up to be a volunteer. So maybe there's something about people who have been thinking about health or who care about health that sort of makes you more predisposed to want to participate in a trial like this. My parents also, I really expected them to be like very unsupportive. And actually that hasn't been the case. I think they've been really interested in the concept. And I think that they are kind of proud because, they raised me to value, not just myself, but, others, and to have empathy and care for, the general well-being of people. And I think this is a pretty clear manifestation of that. So I think that they look at this, and on one hand, they're like, well, not super happy that Carson is putting himself at risk. But on the other hand, I think that they are happy that I'm, acting in accordance with values that we share. All
right. Gentlemen, when I mentioned this story to a few friends, they mentioned, oh, yeah, this is kind of like the chickenpox parties. Is that a fair comparison?
No, I don't think that is. Yeah, this is something that would be done under kind of like the highest medical supervision to the best medical standards, and only in pursuit of a vaccine for other people, right? It's not that the goal of it is not to kind of concoct something ourselves where we're trying to immunize ourselves or things like that. I don't know enough about that whether I have a really well-informed opinion, but I do think it's a very separate effort. Where here, this is challenge studies are things that have been used to study vaccines in a number of conditions, most notably cholera and malaria, and for the flu, where actually the drug Tamiflu was developed with challenge studies. So this is something that has a long and tradition in medicine, and it continues to be a normal method. So I do think those things are pretty separate from my perspective.
All right, Carson and Josh, we're going to take a short break on the air here, but continue the conversation on our live streams, including Facebook Live right now, and we'll be back on air shortly in just a few minutes.
And we're in commercial break. 2 minutes.
All right, now we're on Facebook Live still with Josh Morrison, a member of the One Day Sooner team, which is, saying we can get to that vaccine one day sooner if we do this. And one of the ways is the human challenge trials, which Carson here, a Stanford grad, has signed up for. And I want to ask you guys, is it too early to talk about how that may potentially look in terms of the demographics of people who might be admitted into such a trial?
Well, the sense in which it's too early is that we haven't done rigorous studies or we don't have clear data about our challenge volunteers. We are doing a survey that should be going out this week, a research survey of our volunteers, so I will have more clear data. But what we can say is based on people's responses for why they're volunteering, where people often list their age, education, different things like that. And so, going off of that, which is imprecise, but our general sense is our volunteers are largely, I would say, between 20 and 35, seem to be well-educated. Like, Carson and his friend, who's another MD PhD candidate, they're not atypical. There's a number of people who have, either public health backgrounds, medical backgrounds, biotech or biohealth backgrounds. So that's pretty common as well. And I would say, as far as we can tell, it's a pretty well-educated group. I would say most of the people seem to be kind of like young professionals or graduate students or people with graduate degrees. That's our best sense. And the only other thing I'd mention, this a little bit before, but it's a very globally diverse group. It's true that, well, actually, the United States is only the second largest country for volunteers.
All right. Hey, Josh, hold on to that thought because we're going to come back on the air right now.
6, 5, 4, 3, 2, 1.
And we are back with Josh Morrison, a member of the One Day Sooner team behind a human challenge trial they hope to deliberately expose people to COVID-19, and also Carson Poltorak, who's a volunteer who's choosing to be exposed to the virus as well if he gets that opportunity. He is also a Stanford graduate about to head over to med school in Pennsylvania. I want to share some comments from Facebook now. Carson, what makes you feel the move won't be fatal? What makes you so confident?
Well, the numbers would suggest that somebody in my age bracket has only about, I believe, a 3 in 10,000 chance of dying from a COVID-19 infection. And there are also a number of precautions that are taken in a trial like this to ensure that people are kept as healthy as possible. So you'll be kept under close observation in like a closed, isolated facility. You'll have access to ventilation and medical care, like no matter what. So there's no risk of being a shortage of a ventilator. Should a first-line therapy be approved, it will be available. So we don't have that quite yet. There hasn't been really conclusive data that we have of any drugs that work for COVID-19, but if one's developed in the next 6 months before a trial is done, that would be available. And at the end of the day, we also have to start a trial like this with something called an infectious dosing study. And the goal of that study is to figure out just how much virus to give people, to give them a noticeable infection without giving them so much that it generates a really severe response. So there are a lot of things that we're doing in designing the study that are going to safeguard the health of the participants.
In addition to deciding the dosing, don't you also have to look at what is the best way to administer that virus to yourself? Like what are the potential ways that you could expose yourself?
Yeah, so I mean, you could imagine a nasal spray, like Josh mentioned. You can put virus you can package it into a pill and have somebody swallow a pill. Those are like a couple of mechanisms that I know, and in either of those ways, you can give a predefined amount of viral particles, right? So like if we do the infectious dosing study and we find that 5 viral particles is enough to make 70% of the population sick, you can put 5 viral particles into a little capsule and have somebody ingest it, right? So these are things that are going to have to be determined with testing, but they will be determined.
So I assume you need FDA approval for this, that you can't just start, and you don't have that yet, but do you expect to get the go-ahead?
So yeah, so this is something, we're not the ones who would be conducting a trial like this. It would be done by a university or a hospital or some a group like that. And so there's a few different steps that have to go into it. Now, in the United States, to do this infectious dosing trial, the virus would actually be treated like a new drug. And so you would have to do the same application you would to try a new drug in humans for safety. Interestingly, in Europe and the United Kingdom, you would not need that FDA, or there's EMA, you would not need regulatory approval for that. But yeah, so basically the first step is what's called good manufacturing practices to produce the virus. That takes some number of months. And then there would be this infectious dosing study. And so you would need the FDA to approve the use of the virus before that infectious dosing study went forward.
All right. By the way, I just want to share a couple of comments on Facebook coming in. Linda Petro says, no, I wouldn't sign up for such a trial, but I'm beyond grateful for folks like him that so selfishly do so, or selflessly, pardon me, do so. Nam Vu says there are always brave people in each different field. This gentleman is one of the braves in the science field. So you are getting some positive feedback on what you're trying to do here as well. So what about the World Health Organization? Have they talked about this and any guidelines for human challenge trials with COVID?
Yep. So the World Health Organization is currently putting together ethical guidelines for how to do challenge trials for COVID-19. And they also have panels that are going to be looking at sort of practically how would you do this from a scientific perspective if it moves forward. And we expect that those ethical guidelines, which we've reviewed and we're able to give comments on, which we're greatly appreciative to the WHO, we expect those should be published possibly the end of this week or more likely towards the beginning of next week.
All right, we're just about out of time, but real quickly, when is the earliest that you could see this happening?
Well, I think the key first step before you could, the first thing that would happen is this infectious dosing trial. That's kind of the first challenge trial, even though it doesn't involve a vaccine, but it does involve doctors exposing people to an infectious dose. And so before that has to happen, you need to have this GMP, good manufacturing practices, for the virus, and that's going to take some number of months. I think, realistically, if best case scenario, if we start very soon, fund it very well, and push very hard, I think, the absolute soonest would be something like a couple months from when it started. So I would expect that if things move forward, sort of 2 to 6 months is a realistic timeline for that first infectious dosing trial.
2 to 6 months. All right, Josh Morrison and Carson Poltorak, both of you with 1 day sooner, hoping to be infected with COVID-19 so that you can help lead to a vaccine a little sooner. Thank you both for your time today.
Thank you very much.
Appreciate it. Thanks for having us.
Absolutely. When we come back, we'll talk with a local epidemiologist who broke the news of contact tracing in San Francisco 1 month ago on this show. He's going to weigh in on these human challenge trials and much more coming up.
And we're in commercial break.
All right. Gentlemen, that was a really interesting conversation. Thank you. I learned so much, and I do agree with the folks who say you are very brave for putting yourself out there. So keep me posted on your progress, please. Thank you.
We'll stay in touch. Yeah, absolutely.
Okay.
Thanks.
All right. Folks, hope you're enjoying this conversation today. It's certainly different. That's what I love about what I do, because every day I get to talk to interesting people doing interesting things. And it's like I'm always in a classroom and always learning about the latest developments and fully immersed in learning. So I think that's exciting. Stick around, because next up we have Dr. George Rutherford of Ucsf, who has really been at the forefront in terms of it being in the Bay Area region and leading the contact tracing and the research. Oh, there he is. I'm talking about him in front of him. Hi, George. How are you doing?
Fabulous. How are you?
I'm doing great. Thank you for making time. I know you're busier than ever, especially with the CZI initiative and all that. So I'm still on your list of people to get back to. Thank you. Thank you.
You're welcome.
All right. How much time do we have with Dr. Rutherford, guys?
We're back in 40 seconds
And then
9 minutes total.
Ooh, 9 minutes. Okay.
9 minutes.
Wow. Okay, so feel free to bring up
I would've
anything
washed my
new that
hair
you
by
might
now.
want to near the end there, because I think I've got maybe like 6, 7 minutes of stuff probably that I've penciled in for, but.
15. We are back in 10, 9, 8, 7, 6, 5, 4, 3.
All right, we are excited to welcome back our next guest. He's an epidemiologist at Ucsf and gave us a lot of great information the last time he was here. So, Dr. George Rutherford, welcome back.
Thanks very much.
All right, I want to
Good to see you.
start with, it's great to see you. We talked about the importance of a vaccine, of course, but until then, we can expect new waves of infections when stay-at-home orders are eased. So given that time is of the essence, what do you think about human challenge trials like what 1 day sooner is pushing for? Could they be a potential lifesaver?
It's, the ethics of this are really at the far edge of medical ethics. It's not a treatable disease. We've done human experiments with Zika, which is also not a treatable disease, but this has a higher fatality rate. I think it's pretty far out there, and I think that it's fine to have the discussions and to try and push the envelope here. But it's, there are other ways to accelerate vaccine trials.
What are they? What are the other ways of accelerating?
Basically, you can compress the time frames. You can do them in people who are at highest risk, like among healthcare workers first, people most likely to get exposed. You can be building the manufacturing plants at the same time as you're doing the trials. basically create the whole process in parallel. There are other ways to do it, but I'm not dismissing it out of hand. But I have to say it's pretty far at the edge of ethics.
Is it that we don't have a proven therapeutic for COVID yet? Because they point out that we've done human challenge trials with cholera, malaria drugs, Tamiflu came out of one.
Right. All treatable diseases, right? So I'd say that we do have remdesivir. Remdesivir has been approved under an emergency use authorization for use with people with moderate to severe disease. We'll have to see how it goes. It was an early trial. It got stopped early. There are other trials underway. I think you'd have to hesitate before you stepped into the middle of this one.
I gotcha. And it's very controversial, but I was surprised. I saw that Florida Congresswoman Donna Shalala, who used to be President Clinton's HHS secretary, actually wrote a letter urging colleagues to support, if you will, using this as part of the vaccine study. So having human challenge trials. Was that surprising in any way?
Yes, Dr. Shalala is a pretty conservative person in our world. So I hadn't heard about it before I got the message about what was on the show today, but it surprised me as well.
Yeah. Okay, I want to shift gears because something else that was surprising to a lot of people when it came out yesterday is that the new coronavirus model out of University of Washington projecting 134,000 deaths in the U.S. That's nearly double its last estimate. Why is this projection so different, and should we believe that number?
I think the University of Washington's, the Institute for Health Metrics and Evaluation, has done very credible work through this whole through the whole epidemic. Their estimates have been quite close to spot on. Others have been outlandish, to put it mildly. And I think you have to really pay very close attention to what they're saying. The White House had the New York Times yesterday released the White House's current planning documents that were predicting 3,000 deaths per day in the United States by June 1st, and something like 200,000 new cases each day by June 1st, which is those are truly astounding numbers. Just remember that 3,000 deaths per day is 90,000 deaths per month. There were 56,000 Americans who died in Vietnam, 44,000 that died in the Korean War. That was those were spread out over years. So, these numbers are astounding, and I think really drive home the fact that we need to take precautions very, very, very seriously.
Well, how do we reconcile those numbers, which are alarming, with the fact that states are starting to reopen to varying degrees, but even California taking the next step on Friday? What do we have to watch for as we do this step by step?
I think we have to watch for rebounds in the numbers of cases. The numbers of cases are a pretty sensitive indicator, especially now that we have more testing available. We could look at the numbers of hospitalizations, which have come down, I think, quite dramatically in the Bay Area over time. New hospitalizations have come down quite dramatically in the Bay Area. I think we have to look at a variety of other indicators that we use that look at things like syndromes that people get, symptoms like cough, fever. We have surveillance systems for those, and a variety of other things. But the bottom line is that we have this elaborate contact tracing system in place as well. We're going to be able to catch some of this stuff. In fact, we'll probably be able to catch most of it. But without the cooperation of the public by trying to reduce their risk of transmission, it's going to be an uphill battle.
All right. Well, a key component of this, as you said, is contact tracing and also looking at new data that suggests hotspots. Tell us about what you're leading here as part of UCSF, being partners with the Chan Zuckerberg Initiative and the BioHub in Stanford, and using data to kind of guide us in our decisions. Can you talk about the main components of what you're doing?
Sure. So we have we're doing a couple of different studies. My collaborator, Dr. Bonnie Maldonado, the Department of Pediatrics at Stanford, and I worked together for 40 plus years, are working on a study to understand the incidence, that means the new cases, as well as the prevalence, which is cross-sectionally of infection in the Bay Area. I ran a sample of people from 6 counties. We're going to be able to say pretty quickly what the incidence of disease is as opposed to the prevalence. Incidence is the more important indicator, and prevalence is perfectly important too. Incidence is the more important indicator because it tells you how much new transmission there's been, whereas prevalence could be, it reflects either past transmission if you're looking at antibodies or serology, or it could just look at kind of today how many cases there are if you're looking at swabs. I think that's going to be, we're going to have some geographic spread with it. We're putting the samples together now to make sure we're not missing any hotspots. And I think it'll be very helpful to give sort of a very quick look at what incidence is, but then going forward over the summer and into the fall to identify general trends in the population, pick out hotspots to the extent that we can with 4,000 participants.
I know, yeah.
And
hopefully more participants
and get them
later
referred
on.
for contact tracing.
All right, I want to fold in a question from our Facebook viewer, Connie. She wants to know, what about that new strain of the virus that we're just hearing about, the mutated strain?
These are RNA viruses mutate, not infrequently. This is a very large RNA virus. It actually has an enzyme that repairs its RNA going forward, which is somewhat unusual for RNA viruses. This is also inside virology, sorry, but this is the gee whiz fact. Yes, it mutates. It doesn't mutate at the same rate as other RNA viruses. And my understanding of these new strains is that they're really just kind of markers for how much drift there's been. As you keep as a virus enters a population, it will, you'll start to get, it'll start to drift. You'll start seeing different versions of it circulating. It's a way to kind of mark how much evolution has gone on. To my understanding, this has nothing to do with the virulence or pathogenesis of the virus. It's one of these things that we use in epidemiology and in molecular biology, kind of get a hold on when the virus entered a population.
All right, Dr. George Rutherford with Ucsf. Thank you so much for that. We're going to take a short break on the air, but we've got a couple minutes to address 2 more questions over on our Facebook platform with Dr. Rutherford. Be right back.
We're in commercial break for 2 minutes.
All right, Vanita wants to know, Dr. Rutherford, and I know this is like reading tea leaves and there's so many variables that are changing, so it's impossible to predict. Nonetheless, she's asking you for a prediction of when you think things will totally be back open and back to normal based on everything that you know about, the vaccine development, therapeutic development, all that.
2 years. It's going to take a long time to vaccinate 40 million people in California. If you do 50, if you set up sites where you can do 50,000 vaccinations a day, you're going to need 800 of those to happen. Okay. So it's a formidable task, and it's going to take months to get it done. Maybe 18 months.
Okay,
but
that's sobering.
Vaccine throws a year from now.
All right. Well, we'll keep our fingers crossed, but that's pretty sobering. Real quickly, have you learned anything definitive about whether COVID antibodies can protect you from reinfection?
We know some COVID antibodies can protect you from reinfection, probably. Not everybody has them after they recover.
Not everybody, but why?
You know how in HIV we measure antibodies and they don't do anything immunologically?
Yeah.
It's the same kind of thing.
I guess
some people get good antibodies, some people get junk. A lot of people get stuff in between.
Okay. And then the good stuff can be used to treat and help other people recover, right?
Absolutely.
Okay.
Absolutely.
Dr. Rutherford, great chatting with you as always. Again, thank you for making the time. I know how busy you are, so hopefully you'll come back again soon. Take care.
All right. Thank you so much. Bye-bye.
Thank you.
15.
Oh,
9.
wow.
8, 7. 4. 3. 2.
Okay, while we were on break and over on Facebook Live, I continued to talk with Dr. Rutherford of UCSF, and I asked him point blank, how long do you think before we get back to normal? Where people can go out, everything is no need for shelter in place due to what you know about the vaccine development and therapeutics development. He said 2 years. All right, thank you so much for joining us today on this new interactive show, Getting Answers. We'll be here every day at 3 on air and on live stream, answering your questions, Facebook Live, YouTube Live, ABC7news.com, and the ABC7 News app. All right, thanks for joining us. World News Tonight is coming up next. Take care. All right, folks, thanks for joining us today. You got the best stuff on Facebook. Wow, I felt it was very sobering to hear Dr. Rutherford's assessment, but he's been right before, so we'll see what happens. All right, thanks for joining us.